decision. I spoke to the Prime Minister earlier this morning, and I told him he made the right decision on the border. I also told the Prime Minister that we're very pleased to see the federal government stepping up in a big way. My ministers and I have been in constant contact with our federal partners. We've been working hard to coordinate our response, not just in terms of immediate support to the health system, but also on the direct supports needed for businesses and people affected by the situation. We asked the federal government to implement immediate EI reforms and expand eligibility for workers and families impacted by COVID-19. We also asked Ottawa to provide certainty to businesses by establishing a loan program for those impacted by reduced hours and closures. And today, I want to thank the Prime Minister and his team for their announcement of $27 billion in direct financial relief for the people of Ontario and Canadians everywhere. These EI reforms, doubling the GST rebate, increasing the child care tax credit, providing relief to seniors. These new emergency programs will help families and workers, including those who are part-time and self-employed, along with $55 billion in tax deferrals. That will keep money in people's pockets and in the economy during this critical time. We expect these programs to provide relief as quickly as possible to Ontario and Canadian families and workers, especially those who are now without a job. The temporary business wage relief will also help small businesses, charities, nonprofits, and places of worship impacted by these closures. These are all necessary steps, and I thank the Prime Minister for his leadership. In Ontario, we are first and foremost taking all steps necessary to slow the spread of COVID-19, and at the same time, building capacity in the healthcare system. We're working hard to flatten the curve, and we're sparing no expense, starting with the initial $304 million of emergency relief package we announced yesterday, to add more hospital beds, conduct more screening and testing, including 24/7 screening of staff and visitors at long-term care homes. We're working to set up 25 dedicated assessment centers across the province to ease the pressure on hospitals. We've expanded our testing capacity. We're conducting 2,000 COVID-19 tests a day. We are on our way to being able to do 5,000